Hello all. This is the 255th day of continuous daily Zoom session of International Forum for Promoting Homeopathy. And here homeopathic students and homeopathic lovers across the globe are gathering to enrich, to learn, and to empower ourselves. And to begin the meeting, to start this session, let's have a silent prayer. Hi, I'm Dr. Binduraj from India, who is going to moderate this session. And this is the fourth day of the continuous series of meeting which we are having based on why homeopathy is number 2 in the world. And today we have a panelist of guests and Dr. They are from the
Andrea.
Dr. Elizabeth from Romania is here, and Dr. Andrea Mayer and Dr. A.K. Dwivedi are the guests who is going to speak about this. And all the panelists are talking for 10 minutes. After that, participants will be allowed to interact. So let us start the session, the meeting. And for the talk, first of all, I welcome. Is Dr. Dwivedi here?
Yes, it joins.
He joined. Okay, first let us start with Dr. A.K. Dwivedi. He is a member, Scientific Advisory Board, CCRH, and he is a professor and head of the Department of Physiology, SKRP Homeopathic Medical College, Indore. So let us start with Dr. A.K. Dwivedi. The subject is why homeopathy is number 2 in the world. Sir, you can unmute.
Hello. Yeah.
Yes, we can hear.
Hello, you are getting my voice?
Yes,
Yes,
sir.
yes.
Okay. Good evening to all. Namaskar. The topic is why homeopathy is second option of treatment worldwide.
Yeah.
But in my view, in fact, homeopathy is not even the second option of treatment at present. It is not number 2. Why? At present, yoga and Ayurveda are more popular than homeopathy worldwide. After 2014, when Prime Minister Mr. Modi announces Ayush Ministry, after that there is a worldwide yoga day celebrated in the month of June, and then thereafter naturopathy day, then thereafter Ayurveda day, and also celebrated homeopathy day. But in fact, if I am talking about the yoga, nowadays yoga practices is done by many allopathic doctors in their hospitals, and in fact after COVID, yoga is practices for COVID patient also. And we as a homeopathy, we are not able to allow to practice homeopathy in the indoor patients. So in fact, homeopathy is not even number 2 at present scenario. Yoga and Ayurveda are more popular than homeopathy worldwide. Then why this happened? None of the homeopathic physician is confident. No one is there to be wise. What they are treating, we are not publishing. We need to publish, but at present, homeopathic doctors are not presenting the case. If I will talk about the allopathy is always evidence-based practices, and they are research-oriented. And in homeopathy, we are not research-oriented. We always talk about the patient, about the unka peculiarity, and about the individualization, but we not talk in the terms what the modern medicines they understood. We are, as a homeopath, could not able to get public confidence in critical cases. If anyone has a cardiac arrest, the patient runs to hospital. They are not running to the homeopathic clinics. We don't serve any patients in late night. We are running our clinics for few hours only in a day. That is for 2 hours or 3 hours. No homeopathic hospitals in present scenario in India or in worldwide in comparison with the allopathic hospitals. No glamour with the homeopathy. No one is advertising like allopathic medicines. They are talking about their injections remdesivir, and they are talking that it is not much more sufficient for the treatment of COVID, but the injections are purchasing by many people. They are talking about the vaccines, and they are talking about the vaccines that it is not sufficient to prevent COVID, but people are running towards the vaccination. And in homeopathy, we always talk about all the diseases that we can treat, we can prevent, we can give relief, but the masses are not believing. So we are not getting the beliefs, faiths of the public. Homeopathic, why this happening? This is due to homeopathic institutions are very poor. Teaching are not at past the present scenario. Teachers and students are not aware of the modern investigations. And if I will talk about the specialization, we are not having any specializations like in modern medicines. They are having cardiologist, nephrologist, neurologist, rheumatologist, gastrologist, and in other field. We must give answer to the modern medicines in the form of a specialist in their language, in the investigations. And we always talk, we must talk about the therapeutics. What we are not doing, we are always talking about the person's individualization, not the disease, man is suffering. We are not having any answer of the cancer, carcinoma, metastasis, or no substitution for chemotherapy, radiotherapy, and operations. Our homeopaths are talking about that they have given 1 dose of arsenic album or 1 dose of such medicine, and followed by placebo, and cancer is cured. How it is possible? If the cancer is in second stage, third stage, there is a organ changes in the body, and they have given potentized medicines and followed by placebo, and the cancer is cured and the person is free from the cancer. In spite of such a result, why the patients are going for chemotherapy, radiotherapy, and operation, and recurrent operations, recurrent chemotherapy, recurrent radiotherapy? If this type of results in homeopathy we are getting, so why not we are publishing our results in the research papers? Why we are not giving these results to the media persons? So we must talk about the term used in the investigations, in the CT, in the MRI, in the biopsy. We have to gain the knowledge about the CT, MRI, and biopsy, and we have to talk about in the similar language used in the investigation reports. We are not having any substitute for ICU, and intensive care units. If a patient is serious, then they have to refer to the hospitals. We are not having hospital. We are not running any hospitals. So how we are the second place in the world in the treatment? There is nothing in the case of surgery. We can't do anything in the accident. And nowadays road accidents are very common, and they are running towards the hospital. Our mode of prescriptions are only in the form of pills. Since long, so many years, we are not changing our way of prescriptions. That is only few pills. You have to take these pills. And the people wants in the modern ways. They are talking their operations in the laser, and we are giving only few pills to give the relief. We homeopaths need to be proper training in the institutions in the worldwide. I am not talking about the India. In the worldwide, if we have a better institution where the teachers will taught about the investigations, and students they learn on the patients. In our institution in homeopathy, we are not having patients. We are our students are not trained on the patients. They are trained only on the books and on the PPT modes. So in power presentation we can't do so. They have to talk in the terms of investigation. We have to search solution for bacteria, viruses, parasites, and fungus. And also we are not having any kind of painkiller, where in modern medicines they are having a good number of painkillers, and by the using of painkillers and steroids they are getting the confidence of the patients. If the patient is suffering, they give immediate result, and we are wasting our time in taking off symptoms, totality of symptoms, and repertorization and selection of a single dose, and the patients are not satisfied with our mode of treatment. So in as per my homeopathy is even not second place in the treatment in the worldwide. Yoga and Ayurveda are compelling to complete it. So we
Okay,
must.
thank you, Dr. Dwivedi. Yeah, thanks for your observation. And please stay here because we have other panelists and members will be talking, interacting to you. And please be here, please. And let's welcome from Romania, Dr. Elizabeth Turos. And she is the homeopath who was nominated for Nobel Peace Prize on 2005. She is well versed in classical homeopathy and is an ardent follower of psychosomatic medicines, and some curious things is with her. Let's welcome her. Dr. Elizabeth Turos.
Hello and namaste. Hello everyone, and I would like to thank you very much. I feel very honored that you invited me and you are curious about my opinion. I choose to present to you my opinion in this way. Maybe it's a little bit easier to present. So why homeopathy is the number 2 in the world? In my opinion, the causes, in my understanding, are in one side. The causes are inside and not outside. And I agreed with many things which my colleague, Dr. Dwivedi had said before. And the other side is really that the cured cases are not popularized enough or not correctly. And let's see which are the factors, which are the factors which weakens homeopathy. First, I would like to say that this lack of mutual supportive collaboration between different schools of homeopathy, and of course, I mean this worldwide, and the other one is the lack of unified curriculum and unified requirements for homeopathic practice in different countries. For example, if to be a cardiologist, the curricula and the requirements as studies are the same in the whole world, but to become a homeopath, the requirements are too much different between the countries. In the next, there is a lack of an open, free from prejudice attitude toward each others between homeopaths. The next is the next idea about I would like to speak that how we should present the cured cases with homeopathy. And here I would like to speak about the 3 aspects: how to present the cured cases to the scientific world, to the non-homeopaths, how to present cases between homeopaths, and how to present successes of homeopathy to the large community. Because these are 3 different areas. And for the first one, how to present the cured cases to the scientific world, to non-homeopaths, here I would like to say that it would be very important to assume the uniqueness of homeopathy, that it is based on other principles, and therefore the methodologies we use in allopathy cannot be applied in homeopathy. And this is very important to remind us that the principles formulated by Samuel Hahnemann, that homeopathy is based on individualization and holism. So we treat the person in the disease and not the disease. And that is why, in my understanding, it is very difficult to make meta-analysis or things like that, because how can we compare? We cannot speak about how we treat headaches, because if each and every patient could need and usually need another treatment, no? So that's why, in my understanding, not this would be the important that necessary to do the researches as the allopath does. The next is how to present cases between homeopaths. And here I would like to say that I find useful the different educational platforms for homeopaths, like Facebook groups, journals, to present cases, to grow and to evolve together. But which I do not find okay is that, so I do not find useful for the cause of homeopathy is that no one on the educational platforms filters that who is qualified homeopath and who is not. And usually on these platforms, many times it is used to happen that people are giving advices that what to take in this disease or in that disease. And that means that we do not respect the principles of the homeopathy. Although I know that not the diploma makes you to be a committed or not to homeopathy, because I really met people who had no any diploma, so they are not homeopath and they are still very committed. But still, I think that it would be very important to have a very you know, a professional group, which is not in this moment. And what are the side effects of common platforms in terms of proper promotion of homeopathy? I think that the problem is that learning some tips from homeopaths, but having no basic studies in homeopathy may lead to a shallow, superficial application of homeopathy and poor results. And that is why many people are consider that homeopathy is not effective. And the other issue is that if we do not respect ourselves as homeopaths and our profession, how we can expect to be respected by others? The next is that how to present the successful treated cases to the large community. So here I think that it would be important to present our results, but on the separate platforms where we should present on the level of understanding of the large population, like before and after situation. And yes, here I agree with what my colleague said before, that it would be very important to can present the cases with the different CT examination or different laboratory findings before and after. And the next issue is to have the testimony of the patients, because many patients were cured with homeopathy, and it would be very important to have their testimony on websites, in TV shows, in radio, or in different journals for the large populations. So yes, it is a big question that what we could do, and this is on something on we have to reflect. I would like here just to quote what the famous Hungarian writer had written, that wherever you want to go, you need to know that the first step must always be taken on your own. So with these ideas, I thank you for your attention, and I am open for further discussions. Thank you.
Thank you, Doctor. And let us welcome Dr. Andrea Mayer from Switzerland. She's a homeopath and researcher, and she started a research on COVID-19 in collaboration with Dr. B.K. Bose Foundation, Switzerland. Ma'am, let's discuss on this topic. Welcome to the discussion.
Thank you very much for having it. Can you hear me?
Yes,
Does it work well? Yeah. Thank you very much for having invited me today only. So I had little time to prepare myself, but I have some ideas I wanted to present. First, I asked my 15-year-old son this question, why is homeopathy number 2? And he said, but homeopathy is number 1. This was very nice for me to hear because, well, he often gets to know when cases are running well, and maybe what Dr. Touros said is very important, that we talk about our cases. Also, Dr. Dwivedi, I don't know how to pronounce it, said the same. It's very important, the publicity. I don't know how we can do it, because at least here we can't do publicity officially. We can write something on our homepages, but we can't write in the newspaper, come to my practice. Maybe this is also a problem. I think the main point is that homeopathy could be number 1 and it is number 1 in terms of efficacy and efficiency. And the problem is that this is exactly why there are forces that fight against it. And unfortunately, Big Pharma has much money to do that. Yeah, I mean, all these platforms, like if you search for homeopathy in the internet, at least in German, there you will find the Wikipedia page with this, which is has this influence from people paid by Big Pharma to write bad things about homeopathy. This is the most difficult problem to resolve, I think, but it tells us that we are a real danger for Big Pharma, because it really works what we are doing. Otherwise, they wouldn't attack us. It will be a long process of all people in this world to ask questions and to look behind the scenes in order to have an independent view. People will reconnect themselves to nature and to their soul's origin. Our homeopathic treatments will help them in this process, I think. The 2 main factors that can promote homeopathy, and on that we can directly work on, are good training for homeopaths and good research to prove the efficacy and of this method, and eventually explain the mechanism of homeopathy. The results of a famous Swiss scientist in the field of homeopathy, Dr. Stefan Baumgartner, suggest that in order to explain the mechanism of homeopathy, we need to investigate a natural force that is unknown up to now, similar to gravitation and magnetism. Might be really interesting to find it out. Furthermore, I think the political system is very important. For example, in Switzerland, we have the so-called grassroots democracy. I don't know if I take the right translation from Leo. It means that everybody can vote on concrete decisions. For example, some years ago, there was a votation to include homeopathy again in the health insurance system. It has been excluded for some time here in Switzerland. And as many Swiss people have a homeopathic practitioner as their main therapist, like 60% voted for the inclusion of homeopathy in the basic health insurance. This shows that if really people can decide, homeopathy has a big role in the health system. But if people influenced by Big Pharma decide, it's different. Another important point is to have good structures, as Dr. Dwivedi told us before, good hospitals. And I dream always of hospitals that combine both, with maybe a homeopath as boss, who can decide which is the really important surgery and which surgery has to be avoided. This would be a very good thing, because yeah, we can't be specialists and homeopaths. It's difficult, but there are so many specialists who can make good surgery and maybe also treatment in other specialized things. But yeah, the most efficient thing that comes into my mind when I think about classical medicine is surgery. But we have to decide which operations are good to do. And yeah, there are examples for this combination. And in Germany, there's the University Hospital in Munich, rechts der Isar. They are practicing homeopathy parallel to oncology. And yeah, this should be in many hospitals like this. And then it got into my mind that one of these principles in German, it is von innen nach außen. I don't know if I translate it correctly, from inside to outside. This is a very important principle, and I don't know if other methods have the same perception. It would be very interesting to discuss this with other methods, people who practice other methods, to see if they can learn from us and maybe we can learn from them. I think, yeah, the question number 1 or 2 is not that important. We should promote the point of view from the patient and not the point of view from the therapist. I mean, that would be great. And at our school, at Zug, the SHI, we have many of these presentations for normal people, our patients or other interested people, and they can get to know some of the remedies in acute cases. So yeah, you can say maybe there's less efficiency when they try, but we show them few remedies that they can use in acute cases, and we tell them to go to a homeopath when it is chronic. And I think this gives a good basic basis in the population, and that's why maybe they voted also for homeopathy. Yeah, this is all I have prepared, and I'm very interested in the discussion now with the other presenters and with you.